What's up, Chelsea Place? Hope you guys are doing good. Hey, I just wanted to bring you guys some information. Honestly, if you guys are listening to the news, they're gonna freak you out. So my intention is not to freak you out, but to try to provide a little education, as opposed to just throwing a bunch of scary numbers in your face. Anyways, that's what I'm trying to do. Okay, so I pulled all this information from the Florida Department of Health. So here, this is really all in regards to Florida. Nationwide, the results are very similar, but here locally, I thought I would give you guys kind of a more accurate, kind of just local perspective. Long story short, this, as you can see here, this is the chart from the Florida Department of Health. I don't know how I'm making it on the camera, but the idea is that I just went from basically 3/17, so March 17th, to basically 4/6. Now today's numbers are gonna roll in, and I'm not sure where they're gonna sit at. But what I did do is I broke it down into 3-day increments, and we just ended up taking the average of those 3 days to kind of help us produce what I'm gonna show you here in a second. So long story short, before I get into those details, let's do a quick overview. All right, so in the state of Florida, we've conducted a total of 139,669 tests. So look, boom. Just want to make sure that you know I got all the stuff from the Florida Department of Health, all the charts. But the total tests that we've performed are 139,669. 14,747 of those are positive. 123,000 are negative. Essentially, what I'm looking at here that's going to interesting is that 89.4% of the tests that are taken are negative. So only about 10% are positive. So if you think about that, all those people that are hacking, yakking, think they have a fever, think that something's going on, 9 out of 10 of them are perfectly fine, and they just have regular flu-like symptoms. So, there's that 1 out of 10 that have COVID, and then if you think about that number and you break that number down, the number of people that get COVID, so say out of this 14,000, about 10% of those folks might actually need hospitalization. The other 80 to 90% of those 14,000 are just going to be orders to stay at home and self-quarantine. So just want to break that down with you guys. I mean, I feel like when I understand it from this perspective, just using numbers, it really is a lot less scary than you're going to hear on the news. So in regards to Charlotte County, the number of total tests that have been taken are 737, 67 positive, 663 are negative. That means that about 90.9%, almost 91% are negative, about 9% are positive. So just kind of give you a little perspective here on Florida. Assuming that all this stuff is enough data and things don't drastically change, or there's not some crazy event that happens, the reality of it is that more than likely everything's gonna be just fine, and we shouldn't have to worry. The biggest thing that we'll have to worry about next is kind of just unraveling from this economic event that's happened and trying to figure out how do we restart. How does everyone restart their lives as we roll out of this whole COVID thing? What does the recovery look like? What does that outcome look like? So I wanted to break down this because this is kind of an important chart. So what I ended up doing is I took the new cases per day. So new cases per day, because this is important because this is going to actually outline on a daily basis how many new cases did we have today. Because if that's continuing to increase at a significant rate, it's going to have a big impact on us, because what we're looking for is, where's that plateau? Where are we starting to see the bell curve shape? Okay, so I want to break this down because basically from March 17th to the 19th, the 20th, 22nd, like as you look up here, this is the March dates and then the April dates. Okay, and then what I did here is I broke down. These are the 3-day averages. So I took the 20, like say for instance, the 20th, the 21st, the 22nd. Added those 3 dates individually up and then divided by 3 and came up with a 3-day average. Okay, so this was a 3-day average. So each one of these segments here is a 3-day average. And so what I did here then is like, what was the percentage increase like from this 3-day average to the next 3-day average to the next 3-day average? And so what you see here is from this 3-day average to this 3-day average, you have a 154% increase. from this 3-day average to this 3-day average, we have a 50% increase. From here to here, we have a 95% increase. From here to here, we have a 40% increase. From here to here, we have a 33% increase. If you look at this number is going down. This number is going down, okay? This percentage increase. Now, it's interesting, and we'll see. Only time will tell, okay? But what is interesting is out of at least this period of time, there's the first time in the history of this charting that we've been able to have, do we have a negative number. We have a decrease in the number of new cases. So we went from a 3-day average of 1,233 new cases to 1,067 new cases. Therefore, we have a 14% decrease in the number of new cases. So that's the quick rundown of everything. Again, I'm not 100% sure where we're at in this process. However, I just thought this might provide a little bit more perspective, a better perspective on this particular this whole thing, because I think if I know every time I tune into the news, it's like Armageddon, and then I look at the numbers and I'm like, well, the numbers don't make sense to your Armageddon. And again, I'm not discounting the seriousness of what is happening. It's important for us to take all the precautions we need to, use the face mask in public, keep 6 feet away. I saw my dad the other day and I didn't even hug him. I just did a little elbow bump. We kept our distance 6 feet away, and I was talking to him for a little bit. And we visited for about 30 minutes, but again, at a distance, with face mask and with a 6 foot separation between us. So I mean, I'm taking the precautions necessary. I know that I have to do it for the safety of my family. I know I have to do it for the safety of our residents, my other coworkers I'm working with. I go home at night and I immediately put my clothes into the wash machine. Again, they might be extreme measures. I'm not sure. At the end of the day, all I know is, I'm asking myself, did I do everything I possibly could to protect those around me? And if I can answer that question honestly and be truthful about it and know that I did, then I did my job correctly. But at the same point in time, I'm also paying attention to these numbers because this is giving me confidence in where we're headed with this thing. Meaning, is it so bad that people are like dropping down on the streets, or is it something that is more manageable, where meaning when I go into Publix, am I fearing for my life? Or when I go into Publix, am I okay to wear a face mask and take precautions and mentally I feel okay? And I think that right now it's important to have confidence, that if I take the appropriate precautions and I'm wise and I just do whatever I possibly can, then I've done the best that I can to keep others safe, to keep myself healthy and safe, and not to worry to the extent that it's going to cause other health issues because I'm in such a state of anxiety. So that's why I look to these numbers to kind of be a gauge to myself as to whether or not, hey, is everything going to be okay? Hey, where are we at in this process? How is the social distancing working? How is, what's the effect on all these different things? So I'm sure what we're going to see over the next couple of weeks is because, look, if you look here, just like, you go back, let's see here, 1, 2, 3, maybe 3, 4 weeks, we had a much lower case count, okay? Now we have an increase in number of cases and it's starting to level off potentially. And so that being said, there is going to be an increase potentially in the number of people who are dying. And I don't say that lightly, I just say that because if we had an increase in the number of cases, there's going to be a correlation to that, where you're going to have an increase in the number of people who might be passing away. And just like the correlation of new cases, there'll be a correlation of people who are passing away. And even though the amount of people might be different, there's still going to be kind of a correlation to that. And it's typically about 1 to 2, potentially 3 weeks after you see the correlation in the new cases. So you're probably going to hear more of that on the news. It's probably going to cause concern and fear and worry and all those things as well. But again, I'm just sharing this stuff with you because I think it's important. If you can see these things and you can understand them and you see this correlation here and okay, this is the number of new cases, and then you see like the number of new people passing away, and you see this kind of correlation, this curve here, that we're potentially kind of plateauing Of course, if there's another event, we'll know because we have some numbers to go by. We have some history to go by. If there's another event, a significant event that's affecting all the charts on a national level, we'll know. We're paying attention to those things. So I'm using the numbers as my guide to provide some reassurance and to know that when I'm taking those precautions and stuff like that, that I'm going to be okay. I'm going to be okay. My coworkers are going to be okay. Our residents are going to be okay, and those that we love and that we care for are going to be okay. So I appreciate you guys. You guys are amazing. I hope all is well. Please let me know if you have any questions, and I'll be in touch with more information here soon. You guys have a great evening. Talk to you soon. Bye-bye.